I am now pleased to introduce our first speaker, Dr. Tricia Neuman. Dr. Neuman is a Senior Vice President and Senior Advisor to the President at the Kaiser Family Foundation. She is a widely cited Medicare policy expert and serves as Executive Director of the Foundation's program on Medicare policy, where she oversees policy analysis and research pertaining to Medicare and health coverage and care for aging Americans and people with disabilities. Dr. Neuman brings extensive experience and expertise to this topic, and we are so grateful she is with us today to share her work and perspective. Dr. Neuman?
Thank you, Kate, and thank you, everybody at NIHCM, for convening this panel on a really important topic that affects each of us directly or indirectly, professionally and personally. I'm so honored to be here, to be with Vince Moore and Paul Kaplan, and I look forward to hearing their remarks in a few minutes. Can you turn to the first slide, please? As you've just heard, COVID is taking a disproportionate toll on the older population. COVID-19 cases and deaths are now raging across the country, affecting all of us in all states. But from the beginning, the pandemic has hit older adults fairly hard, not just because they're at increased risk of serious illness and death, but also because of the collateral damage that comes from social isolation and all the lifestyle changes that have adverse effects on older adults, as we'll hear a bit more about later. Looking here at this first figure, what you can see is that older adults account for about 14% of all cases, but 81% of all deaths. This is an issue that clearly affects older Americans and presents challenges for those with and without the virus and their families. And within this older population, some are clearly affected more than others. People of color, for example, account for a disproportionate share of cases and deaths. And as we're going to focus on today, people in long-term care facilities, mainly older adults, and the people who care for them have been ground zero since the first outbreak. Can I have the next slide, please? KFF has been tracking the spread of the virus in long-term care facilities since it started last spring. Where are we today? As of last week, more than 130,000 deaths have been clocked in long-term care facilities. This is both residents and staff. And as you heard earlier, when Kate was doing her introduction, long-term care residents and staff account for 6% of all cases, and now it's about 38% of all deaths. This is down from the spring when it was about 46, 49% of all deaths, but it has not fallen much below where it is today. And in more than a dozen states, long-term care facilities account for half or more of COVID-19 deaths. So this is an issue. This is a true issue for people who are focused on the long-term care population, and for all of us who may have friends and family members, parents and grandparents who are in nursing homes or assisted living facilities. Can I have the next slide, please? The surge in new cases nationwide that we've seen this winter is having spillover effects in the long-term care community. We're not done with this yet, not by a long shot. After a dip in the summer, what you can see in the top portion of this slide is there is now yet another increase in cases among residents in nursing homes. And if you look at the bottom part of the slide, you can see there's also an increase among staff. So we are seeing a reflection of what's going on in communities across the country where cases are rising rapidly, and this is now once again entering the doors of nursing homes and assisted living facilities. Tragically, but not surprisingly, this surge in new cases is leading to a surge in deaths. Next slide, please. This this next slide, this slide that you're looking at now, comes from a new analysis put up by my colleagues at KFF just yesterday, where we were looking at new deaths per week over the course of the pandemic. And what you can see is that after a lull that took place in the summer where new cases started to level off, we are now seeing an increase in cases in long-term care facilities. We're seeing an increase in deaths in long-term care facilities, just as we are seeing an increase in deaths nationwide. And unfortunately, while we don't have new numbers yet for January, we have every expectation that the green line, which is the line for new deaths in long-term care facilities, will continue to tick up in the early part of 2021. Some of the states, some states peaked earlier in the year, in April, when the pandemic first hit. Others are peaking now, and we're also tracking where these peaks are occurring, and they're occurring mostly in the South and a bit in the West, as you might imagine, since you've been following press reports, I'm sure, of the surging cases out West. Can I have the next slide, please? So it's no surprise in response to sort of a tragedy that's taking place in nursing homes across the country that CDC, the Centers for Disease Control, put long-term care facilities at the front of the line for vaccines, including residents and healthcare workers. The initial priority group, that's 1A, includes this population, followed by people 75 and older and other workers and people 65 and older. Earlier this week, HHS revised its recommendations to give priority to people 65 and older, significantly expanding the priority population, remembering that there are 50 million or so people in this age group. So far, this announcement seems to have generated at least as much confusion as optimism among older people as they try to navigate the systems that are sort of in place, trying to figure out if they're eligible, when they can get vaccinated, how they can sign up. And based on what we're reading in the press and early reports from others, this confusion is contributing to underlying fears and anxiety because people are eager to get the vaccine and not knowing how to do it. And there are also real questions about supply not being adequate to meet the demand. Can I have the next slide, please? This is a map that shows the significant variation across states and where they are in their priorities when it comes to older people. And you can see that states are pretty much all over the place in terms of what age group they're starting with. The green states are currently administering to seniors, and the blue states are sort of next to, seniors will be coming soon. This is almost a tricky map to look at because what we do know is that within states, there's a lot of variation county to county. And we also know that even though people may be eligible for vaccines, they're not necessarily getting them because of supply constraints. So again, I think, you may be picking up in the press, we're certainly picking up many stories about a lot of confusion out there in terms of people wanting to know if they can get the vaccine, when they can get the vaccine, how they can get the vaccine, having heard that it's now available to people 65 and older. And I think there's some fair amount of miscommunication in terms of who do they call in their state to get to find out. Can I go to the next slide, please? In some ways, vaccinating the long-term care facility population should be a lot easier than vaccinating the entire 65 and plus 50 million people in the United States. Federal and state governments pretty much know how to find long-term care facilities and the residents that live in them, and the long-term care facilities know the staff that are working there by and large. So To meet this highest priority, the federal government set up a new partnership with national chain drugstores, Walgreens and CVS for starters, to distribute vaccines to nursing homes and assisted living facilities and get vaccines into the arms of residents and staff as quickly as possible. This is a program that is aiming both at skilled nursing facilities and assisted living facilities and actually other residential facilities, although states, again, have some discretion in terms of whether skilled nursing facilities come before other types of facilities. But the idea is to create a nationwide distribution channel to get the vaccines out quickly. In many parts of the country, this is exactly what's taking place. Some places, like some states like West Virginia, has gone in an entirely different direction, not using this partnership. And I think Vince Moore is going to talk a little bit about the issues around the partnership and what's working and what could be made to work better. Can I have the next slide, please? Here's where we are now. And truthfully, this is a slide that can change every day and has changed every day because the numbers keep ticking up. When I first started looking at the numbers that were posted on CDC, these are going to be the first two bars sort of on the left side. You can see that as of January 2nd, there were 282,000 or so vaccines that were given, the first doses, out of 2.2 million that were distributed. That was roughly 13%. And there was a lot of concern expressed at the time that that's just a very small number and things weren't happening very quickly. Truthfully, between January 2nd and January 13th, the numbers have ticked up very rapidly. In fact, I just checked the website today, and the numbers on this slide, which I think I sent in yesterday, are out of date. As of yesterday, at least, there were more than 1.2 million doses that were given out of 4.7 million doses that were distributed. That's roughly 26%. So over this period of time, we've seen an increase from 282,000 doses given to 1.2 or so million doses given. By any standard, this is really good news. This is going in the right direction. It's a big increase. But we still have a way to go, even for this population that's relatively easy to find. 1.2 million is not enough to vaccinate the 2 to 3 million people living in long-term care facilities, both nursing homes or assisted living facilities. This means that many older adults who are living in these settings are still waiting for their vaccine. And it also suggests that the 3 million workers who are caring for residents in these settings are not nearly getting to where they need to be to get vaccinated based on these numbers. Can I have the next slide, please? So speaking of these workers, we've learned and heard that hesitancy is a concern, and hesitancy actually is a very serious concern. This is based on a poll that was conducted by a newly launched KFF Vaccine Monitor Project. And what you can see here, this is a poll of the general public. Overall, 27% said they would probably not or definitely not get the vaccine. The good news is, if you look by age, the number's much smaller among people 65 and older, 15%. And what we're hearing is that older people are indeed doing as much as they can to get in line to get their vaccine, including in nursing homes. But hesitancy is a real issue, and the rates are higher among people who are Black, among people who are living in rural areas, and among healthcare workers. And there's also quite a partisan divide in terms of willingness or hesitancy to take the vaccine. So these issues that are affecting people generally in the public are also affecting people who are working in long-term care facilities. We're hearing that people are really genuinely worried about side effects, fast approval, and the safety of these vaccines. And I think we need to hear what these concerns are. We need to address these worries directly, and most likely use trusted messengers to deliver these messages so that more people have confidence in the vaccine in order to protect themselves, in order to protect residents in long-term care settings, and to protect others in the community. Next slide. The same poll asked the questions about what exactly is that was a concern. And what you can see here are the reasons people said. More than half of all people surveyed said they were worried about side effects. 55% said they don't trust the government to make sure the vaccine is safe and effective. 53% says it's too new and they want to wait and see how it works for others. And 51% cited politics. It's played too much of a role in this development. Now, this survey was conducted in December, and we will be continuing to track the response of the public to vaccines, and we sure hope that these numbers go down. But in the meantime, they are a signal that more needs to be done to educate, to inform the people who are working in long-term care settings so that there's a greater comfort level. We had a briefing yesterday where we heard from the nursing home industry, we heard from the pharmacy industry, and what they're saying is this issue of hesitancy is a very, very real. It's not something that people just say may be a concern. It is a concern and something to be addressed. Again, we hope these numbers will shift and we will be tracking them. Finally, while I've been focused mainly on how COVID affects older adults from the perspective of cases and death counts and the rollout of the vaccine, there is another story to be told. Can I have the next slide, please? There is another story to be told, and Dr. Kaplan will be talking much more about it, but COVID has certainly had spillover effects on the mental health of older people. Here we see that this was work that was done in the summer. 1 in 4 adults ages 65 and older reported anxiety or depression. This was amidst the pandemic. I imagine if we continue to track this, given the suggestions that people stay socially isolated and anxieties about getting the vaccine and getting healthy and moving on to normalcy, we could see more of this in the future. And I think this is an issue that needs serious consideration as people begin to recover from what's been a big trauma for all of us, including older Americans. Last slide, please. So I think there's some good news, some cause for optimism, but certainly major challenges. The cause for optimism, Operation Warp Speed was Warp Speed. That's great. We do have vaccines and they're rolling out. And the numbers are rising, and that too is good news, but they're not rising fast enough, as we've just discussed, and they're not nearly rising at what people would like to see as Warp Speed for that too. The Biden administration plans to invest significant resources for vaccine distribution, and I think there's wide agreement that that will be necessary. But there are also major challenges. Case counts and deaths are higher than at any time during the start of the pandemic. They are surging now, and they will be surging in nursing homes in the earlier part of this year. Once the numbers roll in, we'll see that for sure. Serious illness and deaths due to COVID disproportionately affect older adults and among people of color and in long-term care settings, and that is something that can help drive interventions and should drive interventions to lower the death count. Strategies are needed to reach harder to reach populations. This is not something that I've talked about, but think about people who are homebound, think about people with disabilities who may be harder to reach, or people who don't have online access so that they can't reach the portals in order to sign up for a vaccine on the internet. This is a health equity issue. Targeted education is absolutely needed to make people feel comfortable about safety. And in addition to all the very serious physical health issues, mental health remains a major concern and is one that needs significant attention in the future and now. So thank you very much. This has been a really important topic, and it's timely that you've held this event.
Great. Thank you so much, Dr. Neuman, for sharing those sobering statistics, the recent trends, and the state-level variation. and how vaccine hesitancy is impacting different groups and communities